Hi, everyone. We have a great show with Dr. Sharon Webb, who is a 25-year neurosurgeon and is now the owner of Southern Regenerative and Neurological Wellness in Columbia. And we talk about all things neurosurgery. She talks about being one of the absolute first neurosurgeons in the field, the first one to graduate from University of South Carolina School of Medicine. And then we talk about past her career, what she's doing now, and why she's entered the regenerative space with things like stem cells and PRP and peptides. So we hope you enjoy. It was a great show. Hi, everyone. Welcome to Here for the Health of It. I am Dr. Randy here with Dr. Tom, as always, and we have a great show today with Dr. Sharon Webb, who is a neurosurgeon of 25 years and owner of Southern Regenerative and Neurological Wellness here in Columbia on Raven Road.
Yes.
So welcome to the show.
Thank you for having me.
Thanks for coming. So you are a female that is for 25 years has been in the neurosurgeon space. And I'm sure you have all kinds of stories about that. And I wanted to start out with that because I'm sure it's what everybody's wondering about. So give us a little bit of your history and then give us a little bit about what your wild stories you've had.
Okay. Well, actually, I was the first female ever to graduate from the University of South Carolina School of Medicine and go into neurosurgery.
Wow.
And go into neurosurgery, yeah.
Did you get a plaque?
Yeah, like a photo or something.
No.
We might put one up in this room.
Well, our guidance counselor had said, you sure you don't want to do like peds or OBGYN? Because, again, a lot of women do go into those fields. But I'm like, no. I knew I wanted to do neurosurgery since I was 16. So I knew I went to medical school to be a neurosurgeon.
Wow.
So, and then I majored in neurosurgery at Penn State. So then I went above the Mason-Dixon line to do my training, which was interesting. We had a blizzard the very first, fall that I was there in October, no less, which was really unusual.
Yeah.
And we got 6 feet of snow. We did, and so that was kind of like a quick intro into the north.
Mm-hmm.
And then after I was finished with residency, I did a fellowship in neurotrauma critical care at Memphis, which at the time was the murder capital. So that was the perfect place.
I think it still is.
Yes.
It's got to be.
Yeah, I will never. So I was mainly at the Elvis Presley Memorial Trauma Center, and when you go in, there's always a cop sitting there, And so then when I was going to go out, they're like, you're just gonna, where did you park? And I'm like, well, I parked down the road. And they're like, you need an escort? And I'm like, do I need an escort? So they recommended you always wear your white coat, because then you're less likely to get shot because they might need you.
Right.
You might actually end up helping them.
Holy cow.
Yeah.
So you saw some stuff in that hospital.
I did. I really did. Yeah.
Do you remember your first big case?
Well, there was 2 active serial killers at the time, and one of them kept getting into the back of women's cars in the mall and shooting them in the back of the head. They'd wait on them to come out the mall. So we saw several of those. So I do remember that.
Did some of them make it? I would imagine getting shot in the back of the head, your chances are pretty slim.
Well, the one that I was involved in, they did not.
Yeah.
No, unfortunately. So.
All right, you're 16 years old and you want to be a neurosurgeon. How does that happen? How do you do that? Were you into like blood and guts? Were you into just like...
No, actually, so I grew up very poor, and my mom was the first person in our family actually to ever go to college. And one of her rules was we all had to go to college. And, again, if you wanted a car and you had to pay for your gas and insurance, we didn't have money. And so we all had to go to work when we turned, we lied, said we were 15. But anyway, when me and my older brother, we went to work at 14. And one of the summer jobs that actually paid that I saw was a long time ago. They called it the Partners Program, so it was at Lexington Medical Center. And mainly it introduced you to different kinds of fields of medicine, like nursing and physician too. We would help make the beds and mop the floors and stuff. So I was rotating in the OR, and again, I helped, clean the rooms in between, but there was a female neurosurgeon, and I went up to her and asked her if I could observe a surgery.
Yeah.
And she said, okay, and we didn't start work till 8, so the surgery started at 6:30, so I was able to go in early, and get to see some of it. And that was it for me. She
You were into
took
it.
the skull off, opened up the dura, and the first time I saw the brain, that was it. I went home and I said, I'm going to be a neurosurgeon, Mom.
Really? Wow. I can't even see animals like that. That's
It was
wild.
amazing. It's the coolest thing I'd ever seen.
And you weren't like killing animals or anything like that and
No.
experimenting.
No, I happen to love animals. Yes.
I can't even imagine. So I have a 12-year-old now, and I can't imagine if she pretended she was 15 and then someone was like, yeah, here, let me just watch them
Yeah.
take the skull off. Like, did your mom know about it?
Yeah, no, at that time I was a sophomore, so I was 16.
Okay.
I'd already had other jobs, but we knew we had to have a job. And so for that summer, that came available, and so I applied and got in.
And like that was 30 years ago. So the saw was what? What did that look like?
They were electric at the time. we still had. Actually, I don't know if it's the same drill, but I mean, it was a perforator that goes round and round. It makes the burr holes. We still use the same kind today.
Really?
Wow.
Yep.
That's amazing.
Welcome to Columbia Family Chiropractic, voted Columbia's best chiropractic clinic. With 3 easy-to-get-to locations, you'll be sure to have something near you. We provide drug-free and surgery-free healthcare and take care of a wide variety of injuries. We offer several services from corrective chiropractic care, on-site digital x-rays, spinal decompression for bulging or herniated discs, dry needling and cupping for injuries, pediatric care, non-surgical knee therapy, and a Class 4 laser. And for those focused on wellness, we have a red light therapy bed. We accept all your major insurances. If you click on this ad, you'll get a discount on your first appointment. You can check out our website at cfc4health.com, or you can Google Columbia Family Chiropractic. That's cfc4health.com.
So I guess over those 25 years, what are the biggest changes that you got to see in the neurosurgery world or even just neurological world?
Yeah. Well, hands down, I did my second fellowship in Buffalo, doing endovascular, which actually that was just coming into even being a specialty in neurosurgery when I was a resident. When I started in 2002, we didn't actually do that at Hershey. And one of my attendings when I was a third year, I did 6 years. Now today it's 7, 8 years, but I was one of the last 6-year programs. So when I was a third year, he went away to Thomas Jefferson and did a fellowship in that so he could bring it back and we could start doing it, endovascular. So we started that my 4th year. And that's where you go in through catheters. Like you see on TV for a heart catheter, they either go into the arm or they go into the leg and they take catheters up. Well, they had started, learning actually from cardiology and taking a lot of lessons from that. They started doing things in the brain with catheters.
Wow.
So again, it was a new emerging specialty. And so when I didn't at first decide I wanted to do that. I was an adrenaline junkie and I loved trauma. And so that's why I did my first fellowship in neurotrauma. But I'm back at Richland, and so I came home and I had the job there. And we lost the guy that did endovascular at the time, and I was actually an assistant professor with the School of Medicine. And they were like, well, would you like to, if you'll do a fellowship, we'll pay you. If you'll come back, take call, help out, once a month and that kind of thing. So that's what I did. I actually went up to Buffalo 3 weeks a month. I would be a fellow, and then I would come back, be an attending for a week and take call, help out, and then I would go back. So I'd been out 3.5 years when I did that fellowship. So I'd gotten out of training and then went back into training, which I really don't ever recommend. But I was actually the second female ever in Buffalo to actually do that. And I was the first female ever to finish residency at Penn State. The rest of the females had quit. In fact, my very first day of neurosurgery, the female in front of me, she was a second year and I was the first, met me at the door and was like, here's all my books. Good luck, I quit.
No kidding.
Yeah, so instead of being every third night call like we were supposed to be, we were every other night that year until we got another resident. So it was a lot of call.
Why did she quit?
Well,
you found out pretty quick.
Yeah. Well, so, now they have work hour restrictions, okay, it's 88 hours, a week. At least it was the last time I checked.
88.
Just excuse me if that is incorrect now, but it was 88 hours a week. That was your work. But that didn't occur until I was actually Well, it wasn't law even when I was a chief resident, because I was literally on call for 365 days my last year as a neurosurgery. A lot. I'm telling you, man. It was
Those softies out there complaining about 40-hour weeks.
Yeah. No, I had 3 weeks off, but that was it. And so I literally was so tired, I'd get up, take a shower, put my scrub cap on, and go in every morning. But they did institute work hour restrictions, and it was, they were slowly doing it.
Right.
And as I was still a resident. And so my intern year, it was like 130 hours a week, and I remember standing up in the hall and I'm looking, and we're doing rounds, and next thing I know, I'd fallen asleep standing up.
Wow.
Oh, my goodness.
One time I actually forgot my name. I'll never forget. I was in the ER. I can't even tell you how many hours straight I'd been up. And I go in to talk to the patient. I'm like, yeah, I'm Dr. And I'm like, and he goes, it's on your coat. And I said, thank God. He said, are you okay?
Jeez.
I was like, yes, I'm good. I'm good.
That's crazy.
So eventually, you do get used to the hours eventually, but it is brutal. So that's one of the reasons that, it is difficult for everybody, not just the men,
Right.
but the women too. We do have a different standard. I'm sure that nobody really wants to hear that. And all the women out there, we'd like to feel like there is not one anymore.
Right.
There still is one.
Yeah.
Even when I interviewed, so that'd be 2002, 2001, right, for the 2002. That was the most women they'd ever had interviewed for neurosurgery, and it was 19.
Wow.
So even today, I think the last statistic I heard was that there is 7 to 8% women in neurosurgery.
Huh.
And then when I do the cerebrovascular, the dual-trained neurosurgeons, there's about 220, 250 of us in the country. I think there's like 25, maybe 30 women, maybe.
Of that.
Mm-hmm.
Dang.
Yeah. So it's a small percentage.
Yeah.
Yeah.
I just keep thinking, like, if you're on call 365 days a year, can you date? Can you be married? Can you do?
Not
What
a
can you do?
chance. How do you have an animal?
I was married at the time,
Okay.
and it was very difficult on us. I was no longer married a year after that.
Really?
So yeah, you go in one person and you come out another. It's 6 years. It's
Right.
very difficult. It does change who you are. I don't think all residencies do that, but this certainly does. You see a lot of death in neurosurgery, and it is and can be very difficult to deal with. So yeah, no, but I was married. He
yeah,
rarely saw me, but
Right.
yeah,
I would imagine it's like that for a lot of people in your field.
it is.
And people watch Grey's Anatomy, where all the love is happening within the hospital.
Yeah.
But like, what is that like? I guess because I'm sure people are going through all kinds of stuff relationship wise when they're 365 days a year on call.
Well, that was a special circumstance because I was the only chief resident. We only had, one. The work hours hadn't come through yet, so it's not really supposed to be that way anymore.
Yeah.
Most programs now
Yeah.
have 2 a year. Sometimes they have 3. So there's more, people to bear the burden of that. And again, with the work hour restrictions. So that was kind of the end of that era
Yeah.
of training. And again, it has pluses and minuses. I think there's somewhere in the middle. I think it's gone a little, in my opinion, not that, I'm involved with a ton of residents today. Really, it's more the surgery residents that, I have any interaction with. But, I definitely think they're too soft sometimes on them.
It's gone the other way now.
I feel that way.
Yeah.
That's my personal opinion, though. And, from somebody that, went through hell, right,
Yeah.
for 6 years. So.
Yes. Now, are you still doing surgery now or not so much?
I am.
You are.
It's part-time, though.
Okay.
My mom has macular degeneration, and she's now legally blind and had to, give up driving and a lot of things. And so I decided to step away from neurosurgery for a good bit to take care of my mom.
Yeah.
That's why I ended up back in Columbia.
Yeah.
But the hospital and I, they wanted me to stay part-time, so I agreed. I work anywhere between 8 to 14 days a month, depending on what the need is.
Oh, that's nice.
And then the other time I work in my business in Columbia.
Yeah. So types of surgeries that you do, just so like the listeners know, what are the menu items that you would do that you have as options available in your repertoire of surgeries?
For neurosurgery.
Yes.
Well, I do spine surgery. I don't really do degenerative spine anymore. I did early in my career, but after I became a vascular neurosurgeon, I really just do trauma call. So, if you have something happen and you need a fusion or some kind of spine surgery due to a trauma, I do that. Brain tumors, any emergent surgeries that come in from trauma, head bleeds. Of course, my specialty, which is aneurysms and AVM, so vascular malformations of the brain and spine is my specialty. But
is that what would be what's your favorite surgery to do? Like if you see it, you're like, oh yeah,
aneurysms. That would be my favorite. Yeah.
Really?
And
I'm just shocked by all your answers.
Back when I was young and just out, I did love trauma. Again, that's why. I'll tell you, I was actually clipping an aneurysm when the mass shooting occurred. When I was a resident, it was the Amish shooting that it was at the Amish school, children's school, yeah. And it came over the pager that there was going to be mass casualty. And, so my attending was like, well, you want to go attend to some of the traumas, or do you want to finish clipping the aneurysm? And I was like, I think I'm going to go see some of the traumas because at the time, trauma was my thing.
Yeah.
I hadn't, I loved vascular, but trauma was really more my thing. Now as I'm, and my partners, when I first got out, they were in their 50s and 60s, and I was in my 30s, and they're like, well, Sharon, someday this is not going to be what you want to be doing. And he's so right. They were so right. Because it gets old getting up at 2 and 3 in the morning, and you don't really recover anymore when you're 51, and it gets tiring. On top of having to tell the families that you might not have a great outcome.
So neurosurgeons, would you put them as like the number one surgeon if we're ranking surgeons? Like I feel like I would.
You want me to just step on that? Huh?
Yeah, I want you to rank. Well, and I was thinking about trauma too. Like that's just, you have a variety pack. Every surgery is like
a box of chocolates.
Yes.
You don't know. Yeah.
Versus like, I would imagine like a cardiologist or those surgeons, it's like, oh, it's the heart, it's the same stuff.
I think certainly neurosurgery is one of the more complex.
Yeah.
Yes. So most of the time when you ask somebody, they'll say neurosurgery, cardiothoracic surgery. Those would probably be the top two that they would list as being the most complex and difficult.
Is cardiothoracic, they do both heart and lung? Is that their world?
Yes.
There's not just one or the other?
I think there are probably people that specialize in certain things, within the cardiothoracic community. But, in general, their training, does include both. So when I was an intern, we still actually did an internship. Nowadays, like if you're going into neurosurgery, you might do, 1 or 2 months of general surgery, but a lot of it's going to be, neurology, neurosurgery, kind of mix. When I, back in the day, I actually had to do an internship, so I had to match in with general surgery. And I spent a whole year in general surgery. So I did a couple of months of cardiothoracic surgery, which I actually really enjoyed because I had a lot of critical care. So yeah, when I got on the colorectal, I was like, oh no, this is the wrong end of the body for me, So I actually went back and traded because nobody wanted to do cardiothoracic because it was, demanding and there was a lot of critical care and I loved it. So,
is there been anything that's grossed you out? Like, so my wife's a trauma PA and she loves it. Like, but I always think there has to be things that just roll in and you're like, do you ever get that feeling like this is
my answer will make you laugh. There is some. I don't like slobber.
Slobber?
I mean, really? You will freak me out with that. So,
really?
Yeah, no, I don't care. You can bleed all over me. You can vomit, pee,
Saliva,
whatever, but
like,
just don't. No.
That is wild.
It is. I'm like,
So do you share drinks with people? Like if somebody's mouth is on a cup and then they're like, here, Sharon, have a sip.
Maybe if I know you very well. But yeah, no, that's just one of the things I'm like, I'm
That's
out.
the only
I'll
thing.
be back in when you're done with the mouth care.
So you wouldn't want to be a dentist.
Oh, no.
Yeah.
Who do you beef with the most as a neurosurgeon?
Oh.
Well, define beef, you know.
When I play hockey with the firefighters versus the police, there's some animosity between them. And I would imagine it happens between surgeons somewhere.
You come in and step on somebody's toes. You say, no, this is my surgery. Do you do that ever?
Yep.
I would.
Or
Even
you,
if it's not.
or you just find yourself at a party with them and you're like, all right, we're not hanging out. We don't think the same way, do the same stuff.
Definitely I can go in a room and, you know, if something's happening and it's a trauma patient and I don't like what's happening, I'm like, yeah, no, this is how we're going to do this.
Really? You get to take over.
Yeah.
Well, I mean, if for the neurological piece of it, yes.
Oh, yeah, nice.
Yes.
Yeah. How do you do that? I'm curious about
Well,
that.
I really do like all the trauma surgeons I work with, and
Yeah.
we respect
Yeah.
each other a lot. Yeah, even when we're giving each other a hard time.
Yeah.
Yeah, no, so it's not really an issue. I will say, you know, the cardiologist and the process they have for a STEMI, you know, calling in ahead, doing the EKGs there on site, you know, that's been around for a long time, which is really, you know, the American Heart Association, you know, which has really changed the outcomes for heart attacks. And so we as neurosurgeons in the cerebrovascular world wanted and have tried to emulate that with the strokes, meaning calling in, you know, for, you know, hey, having EMS call in and say, hey, we think this is going to be a stroke, having notification in advance, meeting them at the door, trying to cut down those times, you know, so they have a great system. It's been very interesting though, because everything is so ingrained that, you know, it's heart is time, you know, heart, you know, we gotta get them, we gotta save the heart.
Right.
But it's very interesting. There's just a lot of culture that you have to change for, like, it's the brain. Time is brain. This is really important. There could be a stroke, we need to get them. It has been going on for so much longer, you know, in the cardiovascular realm that people get that immediately. And I'm sitting here thinking, that's just fascinating that you guys are more with the heart than the brain, because I could tell you, you can have a heart transplant.
Right.
There won't be any. And then I have patients go, oh, can I get a brain transplant? And my only question to them is, and who is the donor? And they just kind of go, oh, yeah, yeah, good question. So I do, that's one of the realms I think, you know, we might clash some, is with the cardiologist, and not necessarily them themselves, but just, you know, people getting people, to say this is just as important. And of course, my opinion would be the brain is more important, and theirs would be the heart is, right?
Yeah.
So.
Yeah. Do you I mean, I love the nervous system. Is that like, do you love that system?
Oh, yeah.
I mean, I just can't think of anything that gets better than that.
I completely agree. When I was in neuroanatomy, it was hands down my favorite class in medical school. I loved it, everything about it.
Yeah, like the simplicity of like, I can move my finger. Like just the, like, my heart's beating, right? And my lungs are breathing, the autonomic nerve, like all the things that are happening in my body because my nervous system's doing it, blows my mind still every day. No thinking, no coaching, no pills, no nothing. It's just that intelligence that's in the nervous system is remarkable to me.
Yes, and it's very complex.
It's extremely complex. And I think that's what's tough for me with science, because I think science is so limited to what the body's so incredible that we use what we know about science and not like expand it to like the body just knows better. Does that make sense?
It does.
It's like when we get involved in nature, it's like, well, we might think, well, if you're into this, spraying the sky with chemicals is whatever they're trying to do for our environment. But it's like, no, that's going to have some significant consequences because we're messing with nature.
Yes.
I think about that with the nervous system and the body and everything.
Yeah, I tell my patients a lot, you know, your brain is much smarter than we are.
Yeah.
And it will know what it needs.
Yes.
So you need to listen to it. And if it tells you you're tired, you need some sleep. You know, if you just listen to it, that your brain inherently is much brighter than we will ever be.
Yes. It's the only doctor that knows what every part needs at any given time.
That's right.
Is that, so what brought you into the regenerative space? So like, tell us that story of you moving into and opening Southern Regenerative Neurological Wellness.
Well, so 3 or 4 years ago, I had some real back issues, and it had just gotten to the point where I couldn't even really walk very far. And I remember I went to trick or treat with my nephews, and that's when it really, I was having to walk and stop and sit down, and my brother's like, "What is going on?" I said, "I really don't know, but it's just really been bothering me." And I definitely was not going to have surgery. I could tell you that. So, I went the alternative route, and I started doing different things. And one of the things that one of my other friends recommended was Reiki therapy and balance, therapy and cupping, kind of some of the.
Tell me you tried chiropractic then.
I hadn't been to a
never
chiropractic.
did. All right.
No, I haven't.
Sure, that makes me sick. But go on. I'm going to vomit.
I do refer patients, though, to chiropractors. I just haven't personally been to one.
No, I got you.
But so the Reiki therapy, balance therapy was it was my first foray into really kind of alternative medicine.
Yes.
And she did a fantastic job. Actually, she's here in Columbia. And, they taught you about your triple heater and, what's your stressors and, that it can affect your body and your meridian, and all of that. And so, as, again, a conventional neurosurgeon, I'm like, okay, all right. And then they give you some exercises, which, at the time seemed different. I'll say that, But it worked. I mean, it really
Started
worked.
seeing relief,
Yes, I did. And so then when me and Melissa, she's my nurse practitioner, but she's also my business partner. We opened the business together. Mm-hmm. And we'd be out exercising, and then it'd start to bother me some, and I'd stop, and I'd start doing these exercises, where you're rubbing and you're holding your thumb and, doing this different stuff. Yeah. She's like, "What in the world are you doing?" And I said, "I'm doing my exercises like I'm supposed to." She goes, "You look crazy." I'm like, "I don't care.
Yeah.
Like, it's working. I'm not exactly sure why it's working, but I don't care. Like, it's working, it's helping." And then she got interested in it from a functional medicine standpoint. And so she actually went and got her functional medicine, certificate. And then she was doing some stem cell therapy on the side with a different company.
Oh, yeah.
She said, we should open our own business. Nobody knows about neuro, everybody wants to get into that arena. Mm-hmm. But, we actually do know, you're a neurosurgeon. We should do this. Let's think about it. Let's do this. And so she convinced me to try it. And, it started off, we went for a stem cell certificate course out in L.A. And actually, that's where I met the Erconia lasers, like we were talking about earlier.
Mm-hmm. Oh,
yeah, the Erconia laser guy. And we were talking, and he was talking about this lasers and all. And, I'm skeptical. I'm like, really?
Right.
That laser's going to do something? Okay. And he's like, let me show you. He's like, where does it hurt or what's bothering you? And I had a chronic injury. And so he used it on me, and I was like, this really did help me. And so then we're talking, and he's like, well, it's a family business, and, we're located in Simpsonville. I'm like, you're from South Carolina? He goes, yeah. And I'm like, okay, so we're both from South Carolina, and we all the way out here in L.A., and we meet,
Right.
So that started my foray into the lasers and, kind of one thing, just, and so we finally opened the business February of 2025. So we've been open.
Oh, sweet.
Over a year now.
Yeah, that's great. So neuropathy, we were talking a little bit earlier, and we have a class 4 laser as well. It's just a different company, but it works amazing for stuff like that. So when you first started seeing patients, tell me some of the things that you learned or found out. Because the conventional system is just give them Percocets or gabapentin and
wait until they can cut a leg off.
Yeah, pretty much. Well, because of, my background, and I worked in Columbia, I actually still know a lot of people. I've also worked in Greenville, and I'm down in Charleston, so I've kind of been all over the state.
Yeah.
So I get a lot of referrals, and when I do, they're pretty much all neurological. Mm-hmm. So my first couple of patients were actually nerve injuries. So one had a tibial nerve injury, and another had a lingual nerve injury. And the dentist had accidentally injected the nerve, and so he had gotten a neuroma. And I mean, he was a year into it, and it was very, very difficult to the point, having trouble eating and brushing teeth and like really bad. And so, I talked to him about it, and I'm like, well, let's try the lasers. And we actually did the lasers and a peptide. at first it took 2 or 3 sessions to actually really see any kind of improvement at all, because it was really bad. But eventually, it really did help. It really did. And I was a little hesitant, wondering if it was because it was over a year. It was kind of a chronic condition at that point and severe. But no, it really made a difference. And the tibial nerve injury was more acute, had just kind of happened in the last 2 or 3 weeks. And so, a couple of weeks of the lasers and it knocked it out.
So cool.
Yeah. So at that point I was sold. Well, that, and I used it on my family.
Yeah.
I really used them as guinea
test
pigs.
things on.
I would try different settings. I'm like, now, did that help more? Or did this one? What did you think about this? And so my mom was a big guinea pig.
That's what, and I'm hearing of some of the surgeons in Charleston, they're using it after surgeries to try to help the injury heal faster too.
And the healing. Mm-hmm.
Are you hearing about that somewhat too?
I haven't heard from any of the surgeons in Charleston myself, but certainly, yes. We've used it on several injuries, and it's been helpful, even acute or chronic.
Yeah.
I'm learning, that even with the chronic injuries, it can still be helped. Yes. Yep.
Yeah, nice. So tell us more about the services that you offer over there.
Okay. So we do some aesthetics, but it's really minimal. So we have Botox therapy. We do, again, aesthetically, we have clients that want the Botox, but we also, offer it for migraines, for excessive sweating, for spasticity, so medical reasons as well.
Yep.
We do some of the GLP-1s, the peptides for weight loss. Mm-hmm. And then we have hormone replacement therapy. So my business partner is very passionate, about, women's health, which is very important and underrated in my opinion. And then on our regenerative side, we mainly, we focus on neurological issues because that's a lot of what we get, referrals from. Like Parkinson's, Alzheimer's disease,
MS.
Yes, MS. I've had multiple Parkinson's disease referred, concussions, traumatic brain injury, strokes. Yep.
Hey friends, we all know life is busy. You don't have the time to spend half the day at the dealership. McDaniel's now offers Yes to Go in under 60 minutes. You can even start online from home. When you arrive, your wheels are already in motion. Work your deal your way with paperless digital documents. It's full transparency right from the start with no pressure. A couple of signatures and go.
Yes, that easy.
The quick convenience of Yes to Go. It's more of the McDaniel's difference.
So in the peptide world, there's a whole bunch of new stuff coming out, right? I'm sure you're being in that. You're seeing all the things happening. And I'm hearing
tanning.
about, Retta, TB500. There's all these different ones coming out.
Yep.
I'm curious your perspective on it.
Well, I'll say, I as someone who was on semaglutide, for multiple different reasons. Again, at 51, you've put the weight on, you're trying to get it off, and it can be very difficult. And I'm one that, I'm a big, nutrition's very important, so I'm really big on that. I work out 5 days a week, and still, so certainly age, right, is all the women who are out there listening to this knows, hormones, age, menopause, all those things play a big part in it. So I actually had myself been on semaglutide for those reasons, and because of my inflammation, I have arthritis, so it is coming out now more and more in the research, right, that the GLP-1s have an anti-inflammatory effect, and also which ends up helping cholesterol. So they have a lot of side medical benefits on top of helping to lose weight. So I have tried the retatrutide, I'll say, because
what's that one do?
Well, so the GLP-1s that people probably have heard of, the semaglutide, or the other name for it, Wegovy, and Ozempic, they just focus on the GLP-1 receptor. But then there's tirzepatide that's out, also called Zepbound, and Mounjaro. It works on 2 receptors, so GLP-1 and the GIP receptor. The retatrutide, which is not out yet, So because it's not FDA approved, you can get it, but it's not readily available.
Right.
Works on 3 different receptors. So it's also the GLP-1, the GIP,
Just
and
keep zapping receptors.
yeah, the glucagon. Well, I think the retatrutides, and the more receptors that you work on, the stronger, right, supposedly the drug will be, and then the more weight you will lose. But I just want to point out, it's not a wonder drug where you take it and you shouldn't have to do anything else. Like, you should still be exercising, you should still be having a healthy diet, because that does matter. And one of the things that can be a side effect is you losing muscle mass.
Yeah.
Which is very important. So you really have to up your game with your protein. Make sure you're eating enough protein. And so one of the things about retatrutide, because it works on the glucagon receptor as well, is that you will see less muscle wasting, that you'll hold on to more muscle mass because it's not just working on the GLP-1. So all of the studies have not concluded yet, so that the FDA has not approved it officially yet. But I'm sure that that's only a matter of time before it does.
What do you think of these cats at the FDA? Any opinions on
Okay. I think that anytime that something involves money,
Yep.
that there will at any point be opportunities for people to be swayed
Yep.
one way or the other, depending on how they feel or what they get handed under the table. And I think that that's probably in every single organization, from the NIH, as we learned, right, from the COVID debacle, to, the FDA.
Yeah. It's why, and it's tough for me, because I think a lot of people just put their faith in that it's just this great, clean organization. If it's FDA approved, we're fine with it. If it's not, then run from it. And there's just a lot more to it than
There's plenty of stuff we do in conventional medicine that is not FDA approved.
Right.
Not everything we do is, or if it is, what we're using it for is
not
off
that.
label.
Yes.
Yeah.
So, and that's not uncommon in neurosurgery. It's just that we just don't talk about it that much,
Right.
Or the fact that most of the evidence that we use is Class C. That means 30% of the time you can get it wrong.
Really?
Yeah.
Oh, I didn't know that.
Yes.
I think about the supplement world, and it's so unregulated. It's the other side of the spectrum where
Right.
someone could say there's 5,000 IUs of vitamin D in this, and there's nothing in it. And who's going to check them, and who's going to say anything? And then there's the FDA, which is the other side, where there's so many rules, but there's just corruption everywhere that you just don't know what to do. There's got to be like a middle ground where there's some regulation to keep people safe, but then also the other side of it where it's like, well, we need to do what works and what people want and listen to the doctors, actually.
Yeah. I think that, organizations like the FDA are important. I think regulations
Gotta
are
have
very
something,
important.
yeah.
Right. And there needs to be rules and regulations for the very reasons you just said. But it does take time. And in the meantime, there are people that are suffering and have diseases and issues that conventional medicine has no answer or help for. And so, especially when it comes to the brain,
Yeah.
because that's a real still area that has not been tapped into a lot, certainly
Right.
on the alternative medicine side. And with conventional medicine, we only have so much to offer. And a lot of what we can offer is life-saving,
Right.
but not functional saving.
Yes.
How are you going to live your life now? And so while the FDA is getting all the data and doing all the things it should be doing, that doesn't necessarily mean that some of those treatments out there aren't useful. But I think you need to do what we always do, even in conventional medicine. You take all the data that you have, you make the best guess that you have, again, because a lot of the data we have is Class C evidence, and talk to the patient in depth, let them know what the risks and
Right.
benefits are, and then you give your recommendation to the best of your ability.
Yeah.
What about BPC 157? I want to ask about that.
Yeah, so the BPC 157 and the TB 500, they're probably the two most recognized, other than the GLP-1s, which is
Yeah.
a peptide.
Yeah.
Those are two probably peptides that we get asked about the most and that people are interested in, because A lot of the athletes have used them.
Oh, yeah.
Yeah, and seen a lot of good results from them, right? Because those are ones that help, really to heal from the inside out. Especially people that are suffering kind of long-term injuries that just haven't been able to heal. Even with cryotherapy, which is a great, alternative medicine. I do it myself. I find it very helpful with inflammation. But your body is just not, it still has a hostile environment from too much inflammation for whatever your reason is, that these, help take down that inflammation and then help the cells themselves actually heal. So I think people are really interested because there have been some good outcomes. Now, those are anecdotal outcomes, right? Because we don't have big human studies and it's not FDA approved for that reason. Again, understanding that. I think most of the data on that's going to be anecdotal, but it's compelling anecdotal data.
Yep.
Are there any other countries that you would do surgery in? Like, say you couldn't choose the U.S., where would you go? Like, say Randy wants to get butt implants, and he's been looking at South America.
Probably work. Yeah. Would that be a good spot for those?
No. Well, I did some mission work in Haiti and in Kenya, in Nairobi, Kenya. So those are places that really
Not a lot of resources.
No, there are not a lot of resources there.
No.
So that's definitely eye-opening to what all we really do have in America. There's a lot of programs in neurosurgery that do and offer other places for you to go and do some externships. Australia is one of them.
Yeah, is Australia, like, what would be the country that you would, like, if you had to go somewhere else? Are they doing anything cool in Europe? Is there anybody doing something super different than the U.S. that the U.S. can't do?
A lot of the cutting edge stuff actually gets done in Europe. Yes, in different places in Europe because they don't have the FDA.
Right.
I mean, so they do have regulations, obviously, and things that they have to follow too, but it's not near as strict. So I'll just give you an example in neurosurgery. When we first started doing flow diverters, which is something that it's like a stent, but it's not. It's a lot thicker, and you can use it to treat aneurysms in the brain through catheters, like we talked about. The trials for those in the beginning were all in Europe because it was much harder to get any kind of even IRB, any kind of research approved. Now, eventually, of course, there were United States places that participated in some of the trials, but they were conceived, started, all that in Europe.
Sure.
Just like the discs, the disc replacements, they had been done in Europe a long time before they ever made it to America.
Yeah, I've seen a lot of athletes just going over to Europe for a lot of different treatments and things and the combinations that they're doing. Does it feel like, it almost feels here in the U.S. that there's still this massive like headbutting between conventional and alternative? And it feels like in Europe or these other countries that it's just, there's more of a blend where they'll recommend more holistic things along with medicine or surgery. Is that something you would agree with?
Well, not having practiced in Europe, I don't know, but I would say they are certainly ahead of the game as far as innovation and trying new technologies. Again, I think it's easier to get some of that through approvals over there so they can get it done and start sooner. Keeping in mind also sometimes, so thus they have the disasters, right? Because of that, with some of the technology that seems great, turns out not to be. However, sometimes it's great technology and then they're ahead of us, I definitely think that there is still a huge gap between conventional medicine and alternative medicine in the United States. Certainly the osteopathic schools, I think, bridge that much better, right, than the MD schools. As an MD, we got a little bit of it, but not a whole lot of it.
Right.
They might be doing a much better job now. Of course, I've been out of med school a long time. I'm, of course, much more open to it because of my own journey. And then, Melissa's journey, too, that we, talked about and everything, and how we've seen it change people's lives. But that's something that we learned on our own, did research, was open to it. But I think it's also very important, especially in the brain, again, because, there's only so much we have to offer.
Yeah.
And One of the things I think about neurosurgery that people think it's so advanced, because it is, but it's with the technology.
Yeah.
So the biggest change I saw was when I was a fellow in Buffalo with endovascular, because when I first started, so that had been 2010, this was before the trials for the stent retrievers for stroke began. So, now, if you have a blood clot in your brain and your films show certain things and we think we can help you, we can go up with a catheter and put a stent retriever out and pull the clot out. Wow. And that wasn't available when I first started my fellowship. But by the 6 months into it, the SWIFT trial began, which was a trial for solitaire stent. And so this was back, I'd been a fellow about 6 months. So for 6 months, I got to see, outcomes with stroke where we didn't have a device that really worked. The only thing available at the time was called the Mercy device, and we used to say it had no mercy. So then, I got to see the side of it there, and then this trial comes along, and the first case, I forget the first one we ever did, and you could be on the table 5 and 6 hours with a stroke case and not open the vessel, and the patient did terrible. And so the very first case, it was randomized, so you had to open the envelope, and see which one they were going to get, and they randomized to the stent retriever. And we took the stent up and laid it out. And 2-3 minutes later, we pulled it out, and the patient woke up on the table. Wow. It was absolutely amazing. Wow. So it was night and day.
Yeah.
And since then, there's been multiple randomized trials that, have shown,
right.
Of course, endovascular therapy is, superior to medical therapy with large vessel occlusions. And, but that's what actually began the whole, rigmarole. And catheters are so much more superior than they were. I mean, the generations of our flow diverters that we use, again, that's like a stent, but it's thicker. Right. The very first generation, now when you talk to some of the fellows and all, they don't have any idea what you're talking about, because the first generation was so difficult to deploy, depending on that, and now we're in the third generation and it's so much easier, and you're just like, get out of here. I don't want to hear it. So the technology has changed a lot, but what has not changed is that, sometimes the patients don't come in time, right. And then their brain is gone, and then what are you going to do? And so now they're going to have a bad outcome. But if we, can turn to alternative medicine, then, maybe some of the things that we're using now can help those patients have a better functional outcome.
Yeah. It's like taking x-rays. I remember when we had to, take the cassette, put it in. You had a dark room, put them up there.
Yes.
Now all these young docs, they just walk in, press a button, and then it's over. And they don't realize
analyzing them now too.
Yes. Yeah. Yes. Well, we still had the old films when I was an intern. Yes. So I.
Did you ever have to process them?
No. Okay. No, but we had this one attending who was. Anyway, he always asked you how many slices was it on and how da. I remember I was racing down the stairs to go down to radiology to look at it before I called him, because I knew he was going to ask me all this stuff.
Yeah.
And I tripped and fell and ripped a lot of the tendons around my ankle and my left foot.
Oh no!
But I just kept going. My leg is dragging behind me, and I'm going to get the X-ray. I couldn't get my shoe off the next day because it was so swollen. And the other intern, who was the orthopedist, he was like, "What in the hell, Sharon?" He was like, "Okay, we're going to have to get this off, and you need a brace, and we're going to have to wrap it and all this stuff." So, yep.
Did he ever know that the reason you tore your ankle up is because of that?
No, I never told him.
No.
We had a nickname for him, so no.
But you can't share it.
No.
Okay.
It's not appropriate for children.
Okay.
Now, so I'm curious your opinion on just what you think is causing the neurodegenerative stuff that feels so almost like some people feel like they're just destined to get, but which to me paralyzes them from doing something now. And I've even heard things like Alzheimer's being type 3 diabetes. I don't know if you've heard of that as a theory or thing that's out there, too much sugar creating the issues with Alzheimer's in the brain. You have any thoughts or advice for people that they can start doing now for brain health and to prevent or slow down neurodegeneration?
Well, I think one of the common issues across many diseases, certainly neurological and definitely neurodegenerative, is inflammation. So that's hands down. And I think that's coming out more and more as an issue. And so for Americans, and like we were talking about earlier, again, just some of the basic things that are in our foods, a lot of, we eat a lot of processed foods, the fried foods, the fast foods, in our diet, they make a huge difference. And so both omega-3 and omega-6 fatty acids, for example, they're essential acids. We need them. They're important. But the omega-3s are anti-inflammatory, whereas the omega-6s, if you have too much of them, they will become pro-inflammatory.
Yes.
Not that they're bad. I mean, they do good things.
You need them, but
yes,
in the
they,
right amount.
In the right amount, they'll decrease your LDL. I mean, they do help. But those omega-6s are in a lot of the oils, the corn oil, all those things that our foods in America are fried in. So we end up getting so much more of them. So the ratio should be, omega-6 to omega-3 between 1:1 and 1:4.
Yeah.
1:1 and 4:1. But an average American, it can be 20:1.
I've heard 50.
Well, so I did the test to see what my ratio was, and it was 42:1.
Dang, yeah.
So as a result, I started taking a supplement that is very high in DHA and EPA.
Yep.
Because obviously, again, I know that inflammation is an issue with me. I have arthritis, and so I'm trying to be cognizant and cut down, on things I know inflame it. So I think anytime that you have a chronic, slow smoldering, let's say, inflammation, which our diets in this country, doesn't help. Those that are not, very active, because exercise, believe it or not, can be anti-inflammatory. And in fact, there's more and more research out there about HIIT, high intensity interval training, which is what I like to do. That it actually helps cognition because it increases blood flow. It helps, it makes brain neurotrophic factor, brain derived
cortisol.
Yes, exactly. So it does a whole bunch of things that actually help to promote more neurons being formed, new connections between the neurons being formed. So it actually helps cognition. So exercise can certainly be helpful. Anti-inflammatory diet, taking supplements, eating, healthy foods that have a lot of omega-3s in it. All of those things can help decreasing your inflammation. I don't think that neurodegenerative disease necessarily has somehow just become more prevalent on its own. I think that there's environmental issues that has allowed it to become more prevalent.
Yes.
And those that have genetic tendencies to have it in the first place, when they have a chronic smoldering, inflammatory issue from either not exercising or not eating, doing all the things, eating too many fried foods, all of the things we love to do but shouldn't be doing as much of, that kind of smoldering, inflammation that all that causes allows it to come into play easier than it would if you were actually doing some of the other
things. And the sheer amount of medications that people are on now in the U.S. is mind-blowing. Yep. I forget it's like 8.2 prescription drugs per person, something nuts. I don't know what exactly, but that to me, the amount of inflammation and toxicities and things that's causing. So it made me think when you were saying you got that ratio tested, that's not just general blood work, right? No. You can't, and that, so I always think if I went to my family doctor every week and I was like, hey, I just want to stay healthy and prevent disease and do, that they can't because the testing they're doing is just waiting for something they can give a pill for or send to a surgeon. It makes me wonder, who's the expert that we can trust to go, I want to be healthy. Where do I go? And that's what's kind of tough because people go, yeah, I had my blood work check. Everything looked good. Mm-hmm. It's well, did they check that? No. Yeah. So to me, the functional doctors that are emerging in that space, and that's the family doctor. That's the person that's checking all the biomarkers, looking for all the things that are your red flags ahead of time so that you can supplement correctly, change your diet, do the things that are out there. The traditional family doc to me seems like it's gone.
Yeah, I mean, I think on the conventional side, it's more and more refer.
Yes.
Instead of, okay, let me do everything I can, and then I'll refer you if I have to.
Right.
I think that's very true in that conventional model. This epidemic and issues in brain health and really wanting to be proactive instead of reactive is
Right.
the reason that I joined the Brain Restore program. So that's one of the programs we have within our Regen, and it's actually has the test. That's where I got the test from, and the supplements and all that is through the Brain Restore program. And it has certain tracks. So one is the neurodegenerative, focusing on that.
Yes.
And the other would be traumatic brain injury or stroke, an acute injury to the brain. And it's a lot of tests that we do. And one of them, which is one of my favorites, is called the QEEG. So it's a quantitative EEG.
Yeah.
Because a lot of the questions I get is, well, how do I know what my brain looks like? How do you look at it? How do you test it? So one of the first things we do is, and it's a cap. So literally you fit the cap on, and it's got all the electrodes coming off of it, like you see on TV. And then we hook it up, and it has software, and so we run the full analysis. And actually there is some AI in it too, which is, talking about AI, it's really interesting.
Great.
And so you of course we've talked to the patient, what are your concerns, in which a lot of it will be brain fog, cognitive issue, maybe sleeping, that'd be a common thing. And so then we do that, and it analyzes, and it says, hey, you know what? You have too much activity in your temporal lobes here. This could be the reason that you're having, these headaches. And then your brain fog, your activity here in your frontal lobes, it's low. This could be, so it analyzes based on your issues. And then it gives recommendations for neurofeedback.
That's awesome.
Yeah, I'm really excited about that piece of technology. And so that's one of the things. And then we do a balance test, because one of the first red flags that you might have neurological issues is your balance.
Really?
Yes.
Yeah, that's
yes.
interesting.
Certainly with the neurodegenerative disease, right? And you think about the Parkinson's and Alzheimer's. I mean, your gait is very important. Yeah. And so, funny story, I just wanted to play with it and practice it, and I wasn't thinking about it doesn't matter what your birthday is, so I put it in, and it made me 20. So here I test myself, and then when it comes out, it gives you percentages based on your age. I'm like, oh, I should have paid attention to my birthday. I'm looking really bad right now, But anyway, so we do that, and of course the neurological exam, and then we have questionnaires, and actually there's a score that you give them, and a cognitive exam. We use the Montreal cognitive exam, so it's really a thorough, evaluation. And part of that's the brain spot. I talked about the blood and then the cognitive test.
Yes.
And then we say, okay, here's your score, here's your issues, here's the plan that we suggest for you. And it involves the neurofeedback, hyperbaric oxygen therapy, the low level lasers, the Zirconia lasers, and then the supplements.
Yeah.
So, and there's also exercises to do at home. So it uses all of that, to really help out, because, hyperbaric oxygen, it helps increase blood flow.
It's so good.
Yes, it's really good for cognition. The low-level lasers, we have what they call the energy failure model, which basically means, your cells are there, but they're not doing a great job. And so it actually stimulates the mitochondria in those cells, the engine in the cells, to say, you need to do a better job. Here, let me help you. I'm going to stimulate you. You're there, but you're really not doing your job, buddy. You're not pulling your weight, And so it takes all of that, and the neurofeedback, which I have honestly found fascinating. I've been practicing on myself, and it really does help with your sleep and all these issues. So, so that's the program and the reason we got involved in it.
It's incredible. I mean, it's all straightforward and simple. Like when you're saying it, I'm like, okay, oxygen, yep, light, yep, movement, yep, like sleep. There's nothing magical to health. We just don't do a lot of it consistently. And I love that. Yeah, I like that you're a part of that, because those are the things that people just need more of.
Yes.
You can't go wrong with those. You know what I mean? It's like,
Nope.
I don't know how you mess that up.
Yeah, consistency.
Is the key.
Yes, that really is. It's the key. I don't have a magic pill, because I think a lot of people would love that.
Right.
Hey, why can't I just do this, or why can't I just take this one pill? But it's not that simple, and it's starting from within. So I really like the your sign you had in the bathroom, actually, because it's saying, we're not here just to, adjust you. We want to start from the inside and then fix you from the outside. We're not here to take, just make your symptom to help you with your symptom. We're here to help you with your disease process.
Yes.
So we can help you with your function.
Yeah.
It's so fun hearing this too, because I remember like 2010, we were doing workshops and we were getting complaints. Like I remember there's complaints from the dietary guidelines when we were saying like everyone's eating too much sugar and people were calling us crazy, and we were saying everyone needs vitamin D, everybody's deficient, and we were getting so much pushback from the medical community. And now I feel like the research is coming up where it's even just normal now. Like you can just say like, yeah, you need supplements, you need to eat better, which was, I don't know if you remember 15 or 16 years ago, but I feel like the medical community didn't embrace that at all, or you would have been maybe a bit of a pariah back then. And now they're kind of saying like,
ooh, a big
yep,
word.
we get that.
Absolutely. I mean, vitamin D is one of our, common labs we send on our panel.
Yeah.
Is it?
Yes, yes. Mine literally was non-existent. I
No
mean, literally
way.
it was
Whoa.
like less than 3.
Yeah.
Yes.
And even isn't it like the number that they want is only 30, which still is low. So like most people come low even up on that, but I think you want it to be like above 60, 70 in that range.
Yeah.
Yes, you want it much higher. So, I take 10,000 units a day.
Yeah.
Really, so, and that's one of the labs that automatically come on the inflammatory panel too that they do.
And it's so cheap. That's what drives me crazy, is so many people could get so much healthier by one blood test and then one of the cheapest supplements you could ever get.
And get out in the sun, get some
Yeah,
free
or do it that way.
free vitamin D.
Yep.
I had a couple more questions just in the surgery world too. We love checklists. Do you guys have checklists like pre and post surgery where you like literally look at a sheet and it's like done, done, done?
Well,
Just so our team hears this.
okay. I mean, we have a timeout. So anytime you go into surgery,
Yeah.
First off, you have to have marked the patient. So that's very important. So
Get the right
so right or
body
left.
part.
I mean, there are wrong side surgeries that do occur. So this is very important.
Yeah.
As a neurosurgeon, we always pull our films up. So we are double checking the mark. We're looking at the films. But then you have your consent too. So as part of the timeout where everybody stops, we go check with anesthesia. Yes.
Yeah.
You say the name, you read the consent. Everybody agrees this is the right patient. It's the right side. It's the right surgery. You have what you need. They go through the equipment. So there's these checklists that are required. Just like at the end, there's instrument counts, needle count, to make sure everything is,
you close them up and there's not parts or things in there.
Correct. Yes. But as far as the surgery goes, you've taken the bone off, check. No,
Not that,
not those.
yeah.
But yes, pre and post.
Pre and
yes.
post, yep.
Absolutely.
Okay.
Yes, we do.
What's the longest surgery you had? Do you remember like the one that stands out to you or?
It was 15, 16 hours.
16 hours?
Mm-hmm.
What do you like? Do you drink any water? Do you pee yourself? What do you like? Are there times? Do you call like a timeout?
You would be surprised that you are so focused on what's going on.
He couldn't do it. He pees every 45 minutes. He couldn't do it. I could do it.
There are old wives' tales that some of the surgeons used to put a Foley in, but I have never seen that personally. But
Wear a diaper.
you're so focused, honestly, that it doesn't even occur to you. But then when it's done and you're finishing up and you're sewing up, then it hits you and you're like,
Holy cow, yeah.
boy, okay, we got to get this done.
So you're 16 hours over a body nonstop?
Yeah.
Really?
Yeah.
Does,
I can't
does
remember.
crew switch out? Like, is there any like shifts?
Yeah.
Really?
So anesthesia, the CRNAs are usually the ones running the show. They switch out. They get lunch, and then whoever, and normally the OR techs switch out about 3, 4 o'clock in the afternoons, and then you'll get the night shift. So yeah.
Were you listening to music? What do you do during that?
You can. Yeah, typically I do. I like the 80s. That's my thing.
Really? What kind of songs? Like rock and roll?
I like, Billy Joel, Phil Collins, Michael Jackson, Journey.
Yeah.
Oh yeah, Def Leppard, Van Halen. I mean, come on. The
You sing,
80s.
it's closing time.
I love the 80s. The 80s, in my opinion, had the best music and movies. So.
And you control it. So if there's a bunch of 25-year-olds in there, you're just rocking out to the 80s.
Yes.
And they've never heard it before.
No. They don't know what a Mr. Yuck sticker is or or Rotodile. So, yep.
And then has there been anything you've seen in your conquests of surgery that made you change something drastic in your health? Where, I don't know, you're looking at a brain and you're like, or anything, a spine, where you walked out and like, all right, I don't know, go for a walk more. Or even just like body types, I guess, that you're working on.
I have only been on an ATV one time, and I held on for dear life because I've seen a lot
So
of deaths from
many,
ATVs. I don't get on motorcycles. We call them donor cycles. So,
Yeah.
there's definitely things I do not do. My nephews do not play football,
Concussion stuff.
Uh-huh.
Yeah.
Yep, that was a no. And they want him as a linebacker. I mean, he's like 6'5", at 220. I'm like, nope. Basketball is great. And then there's tennis and swimming.
Golf.
And golf.
Horseback riding, I find a ton of people get injured in.
They do, yes. I have seen them get thrown off. I've seen, head injuries when they get kicked in the head. I mean, yes, I've seen a lot of that as well.
You know what some of the worst spines we've seen is like truck drivers because of like the vibration and just sitting for that long up and down on the back and discs and then pumping the pedals, like just the imbalance of the pelvis, all that.
Yeah, with the degenerative disease.
Yeah, like that and tractor, yeah. And then
We got to do this.
oh yeah, we got to do that too. Is there been any surgeries that you? Oh, I can't even read my freaking writing here. That you would suggest, like you mentioned, you don't want personally to have a surgery, which I think is the sentiment for most, but I don't know. Like sometimes I meet people and they're like, I don't care, like they have surgery for that or they have medication for that. But I think most people want to just avoid surgeries. Are there any surgeries though, like besides all of them, that you're like, avoid this one at all costs if you like exhaust all options before even thinking about this sort of barbaric, if that's a good term for surgery, I don't know. Does any surgery come to mind where you're like, gosh?
Yeah. Honestly, for me, it would be back fusion for back pain.
Yeah.
I mean, if I'm doing a fusion, it's because you have had a terrible accident.
Trauma, yeah.
And you're unstable. And if I don't, you're going to have bad spinal cord injury. So I know I need to be there. Some of these, I think we don't know the answer. I think that, we look at the films and we look at the patient and, they're in pain and you want to help them and do something. And you're like, well, okay, here's the options, but it's still not a great option because nobody can tell you this is real. We know for sure this is going to work.
Right.
We don't know for sure it's going to work.
Yeah.
Sometimes it does and sometimes it doesn't. So,
Fusions, yeah.
Yep.
Yeah.
So we have Gallup Design Build. They're our sponsor. They build custom homes for the most successful families in the Midlands. And we have a question for you. So we have our little question box. Do you have RB out here?
Oh yeah, here he comes.
Yeah, I'm actually curious
what are you doing,
too.
RB down there?
So one of my favorite questions is like, what vibe do you like better? Do you like a nice suited up and tie, or do you like more of like a tank top, kind of show off the biceps?
No. Suit
You
and
like
tie.
a suit and tie?
Yeah.
No.
No.
That's the one.
All right, here's the question. So pick out whatever one you want. Okay, and then read it out for us, and we'll talk about the answer.
Oh, the last handwritten little deal. Uh-oh, I have no clue what it is. It's so weird.
Are you a bath or shower person?
Oh.
And why and how often? Okay.
That's a good
That is
question.
good,
That came
especially
right
for a
from
surgeon.
RB.
Yeah, no, I'm a shower person.
Yeah. Okay. Speed.
Yeah, yes, probably. But I don't know. I've never been one to, let's just hang around and then we'll stay
Lay
and get
around
pruny.
there.
And no,
Yeah.
I got stuff I got to do. And then how often? Oh, no, I'm a every day.
Okay.
Yeah.
Do you wash your hair every day, though? Because that's a big topic of debate.
Most of the time, yes.
Yeah. You just slip. Like I try to not wash it, and I still wash it.
Me too. I can't
I try
imagine
not
working
to,
out
like,
and then
I
not washing my hair.
Well, I have short hair. I mean, it's
Yeah.
pretty easy. You
Yeah.
know, easy to do, easy to take
Yeah.
care of.
Yeah. So and then so if you're building a custom home, walk us through that. What
Your
would
master
your master bath?
Oh, okay.
Any features you like in that?
A big shower with like 10 shower heads.
You like all the
Oh,
jets?
that would be we should ask RB if he's ever made 10 shower heads.
Yeah, something
I
like
hear
that.
about 2 shower
with a
heads
stereo
lot.
system, in the shower. Yeah.
Oh. Rock your 80s in there while
Yeah.
you're getting ready.
That would be kind of cool.
Yeah.
I've seen like TVs in there.
Yeah. I don't know. Yeah, no, not TV.
You don't want to watch Star Wars while you're showering?
No. I do love me some Star Wars, but no, not in the shower.
10 shower heads. Like back when I played hockey a lot, which I guess I still do. Actually, I guess they're still there. Like in the shower room, it's just a square with 10 shower heads.
But there's dudes.
Yeah, but there's 10 people in there. They're not all 10 for one person. All right. I love that. And then you did a renovation before, right?
Yes. When I moved back to Columbia, I bought a house. It was in 1938. And, yeah, and so I renovated most of it.
Yeah. What are some things that you learned from that?
Well, renovation takes longer than you think it will, and it's
Double
a lot
or
more
triple.
expensive than you ever think it will. So I renovated the whole bathroom. That's how I know, because I had a big shower and it didn't have 10 shower heads, but it did have stereo system and all, and I loved that shower. I hated to.
That's nice.
Hated to leave it.
Yeah.
Nice. So what's the process if somebody wants to see you guys? They call in, what's day one look like? What's the eval, all that good stuff?
Yeah. You can request an appointment on our website, or you can call in too. We're open Monday through Friday, 9 to 5. And depending on, what you want to be seen for, we'll set you up for a consultation / treatment, depending, sometimes we do it the same day. We usually do a consult because we have to order stem cells if we're going to do that. But we try to get you in as soon as possible.
Nice.
So within the week if we can.
Great.
2 weeks, the absolute latest.
Yep.
Nice.
And so it starts with a consult.
Yes.
Is it in person or telehealth, or how does it
it's-
work?
it's
usually?
in person.
In person?
Mm-hmm.
Awesome. Yep. That's great. I mean, this sounds great. We've been needing this in Columbia really bad. And all the services that you have are things that I think people always want. They just don't know where to go find them or what to do. So this has been great. Anything else you want to share or promote?
I was going to say, we do get a lot of phone calls about, stem cells because, and there's a lot of
Right.
myths or however you want to, urban legends,
Yeah.
about stem cells. You could take them and they're going to grow you a new liver and,
Right.
whatever, and it's going to fix whatever. That's really not how they work. It all goes back to the inflammation,
Yep.
And that's a lot of what not only the stem cells but the peptides do as well. Even the hyperbaric oxygen, what it does is it takes down a lot of the inflammation in your overall body to allow for a healthy, environment within your body and within your own cells, so that your body can do a better job.
Yeah.
So actually, the way that again, a lot of the peptides, certainly the stem cells work, is that they downregulate naturally your immune system. They, yes. It's possible that they might become a certain type of cell, but that's really very minor, and it's,
Right.
less than 5%, if any at all. And their real positive effect is they take down your inflammation and they help your cells that are already there do a better job,
Yeah.
just like the low-level laser therapy does. And
nice.
the more your disease is embedded in inflammation, for example, autoimmune diseases, because that's really what its main
Right.
issue is, then the more helpful that those kind of treatments are.
Yeah.
That's good.
Good.
I got to ask a little bit more about your
Oh,
personal
yes.
life, because I've just been thinking, we haven't really got into it.
Okay.
Give us, what do you like to do on the weekends? What's fun to you? Where do you go? Who do you hang out with?
How many different pairs of glasses do you have? I'm a big glasses guy.
Reading glasses? I mean, I have 2 pairs of glasses. I thought you meant like loops because I have you have special glasses for the endovascular suite, and I have 2 pairs of loops for the OR. So what glasses are you referring to?
No, like the ones you're wearing.
Okay, 2. I have 2 pair of reading glasses.
And they're prescription, or they're just for
they're
looks?
They're progressive. You know, which takes a while to get used to. Anybody that's ever had them. I keep doing this a lot, but they're progressives.
Okay, and then what about weekends? What are you doing for fun? Ideal weekend?
Well, I ballroom dance, so
Yes. You didn't see
We
that
almost
coming.
missed that. Yeah.
yeah, no.
Wait, where do you
this
do
is
that
a funny
at?
story. So this is a funny story. So when I was a fellow at Memphis, you know, I had just come off, you know, a year of call straight, right, that we talked about. And so, you know, I was only on call 5 days a month, which I didn't know what to do with myself. And so, you know, a couple of the residents I didn't think were working hard enough. And anyway, so my fellowship director's like, Sharon, you've got to get a hobby, you know? And so I actually went to take yoga at the YMCA. And after yoga, there was a dance class, and I started seeing these people come out. And I was like, oh, what are they doing? You know, so anyway, I found out they were dancing, and I said, you know, that sounds like fun. So I joined. So I've actually been dancing since 2007.
Wow. Where do you do that here in Columbia?
Blue Moon Ballroom. So that's where I still take private lessons, but they have parties, you know, so you go and you dance, and so I enjoy that. And then I paint. So I do acrylic painting. So that's another.
Nice. What kind of style? What do you like? Like
Abstract.
Abstract.
Oh yeah, no, like I have to color in the lines all day. I don't want to do that when I'm having fun.
Yeah.
So your ideal weekend is painting, ballroom dancing, and then what restaurants are you into?
I'm not really a foodie.
Oh, you're not?
No, I'd rather be out in my garden with my own vegetables, my tomatoes and cucumbers, and I'm not a huge food. My favorite restaurant is my mother's kitchen table.
That's
You know,
good.
it's going to be hard to beat her food.
Yeah, love that.
Yes.
Well, this has been fun. This has been great. Thank you for being on the show.
Yeah.
Thank you for having me.
We're here for the health of it.
For the health of it.
Just a quick note, this podcast is for informational purposes only. We're not meant to replace your doctors, and nothing here should be taken as medical advice. Always check with a qualified professional before making decisions about your health. The views and opinions expressed by our guests or hosts are their own and do not necessarily reflect those of this podcast. Reliance on any information provided is solely at your own risk.